Thank you, Tom and Rachel, for the kind introduction and for the opportunity for us today to share with you all the KNN Learner Network and our energies to promote flourishing in medical learners and trainees here in the US. I did want to also take a moment and thank the Jubilee Center for their work in organizing this webinar series, as well as acknowledge the continued support for our many efforts by the Kern Family Foundation. My co-presenters today are Joëlle and Lamya. They really do the bulk of the work as it relates to making the Learner Network be as successful as it is, and I just have the opportunity to work with them on a continual basis and today share with you a little bit about what is the Kern National Network, and they will share with you the details on the Learner Network itself. So to overview, the Kern National Network is a movement to promote flourishing in medicine. We lean heavily into our four foundational principles, which are character, caring, practical wisdom, and the promotion of flourishing. And for our learner-centered work, really try to bring these sort of foundational elements into a place where they can ignite positive culture change within their experience of medical training. Our definition for flourishing at the KNN really focuses on finding and helping our learners move into this journey of wholeness of being and doing. How do they realize their own full potential? And then how do they help each other do the same? Much of this is based on work by Dr. Sue. We also lean heavily into work of Tyler Vandervelde and the Harvard Flourishing folks and look at those areas in which flourishing can be measured across the domains of happiness and life satisfaction, physical and mental health, meaning and purpose, character and virtue, and close relationships. We also stress with our learners how these sort of domains of flourishing can be sort of enhanced and promoted through pathways of family, work, education, and spiritual community. As we explore the foundational elements of character, it's important as we get together with our learners to think through what character means, and that could be best described from our perspective as a constellation of characteristics made up of both moral, civic, intellectual, and performance virtues that are formed over time and manifest in our dispensation and practices. Sort of a character has both this internal and external component, which we also feel is really well represented by something the Jubilee Center has put together in this wonderful Cultivating the Building Blocks of Character diagram. I wanted to mention really quickly that in medical education here in the US, we tend to focus a lot of energy on performance and intellectual virtues. And an important part of our learner program is also helping to see how these virtues work together in tandem, and it sometimes need to be called upon in ways in which they express conclusions to difficult moral decisions or situations coming our way. This is a great chance to practice practical wisdom. These cultivating the building blocks of character have become really important, I feel, for our learners to think through how do their daily experiences influence them and those around them through the aspects of virtue practice, the practice of practical wisdom with the hopes of promoting flourishing. While we were on this concept of thinking through what does practical wisdom mean and how might practical wisdom come into practice, we also try to explore not just the individual practice of practical wisdom, but what does it mean to get together as a group and learn and collect the wisdom of the power of our collective reasonings and collective experiences and begin to explore when faced with challenging moral dilemmas, how might we together share both success stories and challenges and do so in a reflective community of practice. When the KNN explores terms such as caring, we really like to expand caring beyond just a place of what does it mean to prescribe in healthcare, but how does caring move into a place where we care with one another? We see caring as a sort of this component that has both phases and moral elements. Those phases are highlighted in the darker blue color here, which talk about caring about, taking care of, caregiving, care receiving, and caring with. And those happen in tandem in combination with our moral elements of attentiveness, responsibility, competence, responsiveness, and at a greater extent, how does this play out in the communities around us, even to the extent of how does it affect our democracy and our commitment to those principles? So we almost see caring as at times a huge prerequisite as well as a practice to promote flourishing. Another way to explore this diagram of what does caring look like is through these circles of representation of caring with ourselves, caring with individuals. How does caring extend to the institutions and the department we work with? How do we extend caring to our communities? and in the process, building a democracy. So that care becomes an essential part of us reaching that definition of human flourishing, of reaching our full potential, and to realize that our scope in this area is both from self to the entire society. Lastly, in my quick, brief overview of the Kern National Network, I want to share with you our framework for our guiding North Star. There's a lot behind this diagram that I won't get to share with you today, but we use an image of a tree to represent the interconnectedness of caring, character, and practical wisdom in the promotion of flourishing. I'd also like to highlight that we use these multiple colored leaves on the tree to help our learners recognize that this is a journey that can wax and wane and can have seasons of great growth and seasons of recovery, and that all this happens again in that same context that we just talked about with caring. The flourishing happens in a space of individuals. Flourishing happens in a community of other professionals. Flourishing is experienced in the systems in which we are part of and the society in which we live. I want to thank you all for the opportunity to provide a very brief overview of the Kern National Network and our guiding framework, and I'll now transition our presentation over to Joëlle so that she can share with you more details about the Learner Network.
Thank you, Jeff, and thanks again to the Jubilee Center for allowing us to be here today and share about our work. There are 5 national strategies that undergird the current 5-year period from the KNN, including building a knowledge sharing and practice community, developing leaders for flourishing in medicine, bridging across differences towards flourishing, changing system, culture, policies, and practices, furthering scholarship, dissemination, and convenings. While the KNN Learner Network works amidst many of these strategies, it takes an explicit focus on developing future leaders for flourishing in medicine. The KNN learners themselves are creators, presenters, innovators, and change agents within some of the 155 U.S. allopathic medical schools leading to the MD degree, the 42 accredited U.S. osteopathic schools leading to the DO degree, and some of the 145,000 resident physicians in the United States. They are nominated as well as self-selected to take on leadership work with the KNN in addition to their studies in medical school or their obligations within their resident, fellow, or intern trainee periods. They are a diverse and vibrant group of individuals informed by their experiences within healthcare and committed to working towards transformation. The program aims and intentions seek to work against the many environments medical learners find themselves in, where decisions are often made for them and not by them. These include increasing virtue literacy amongst U.S. medical trainees or learners, which include medical students, residents, interns, and fellows, using the KNN Framework for Flourishing. Creating a base of key stakeholders with the shared language to discuss concepts within the framework and their applicability to medicine locally and nationally. Engaging U.S. medical trainees to activate their knowledge in their local contexts to identify and articulate what constitutes flourishing in medicine. Empowering trainees to suggest and implement programming that applies the KNN Framework for Flourishing to their learning and practice environments. And finally, shifting practices, cultures, systems, and policies to promote flourishing. Several theories inform the design and implementation of the programming, including engaged pedagogy and the notion that learners themselves should play an active role in their education. Leadership practice and cultivation, specifically in the context of character education. Backwards design methodologies that support learners in identifying aspirational aims, such as flourishing, and creating their own interventions with the potential to move towards those aims. And finally, the importance of reflective practice and becoming reflective practitioners. The KNN Learner Network is a multi-component intervention that provides several entry points and includes different levels at which learners can engage. This hopefully supports the integration of this work into their actual responsibilities as students and trainees, making it a feasible added element of their journey to become future physicians and healthcare providers. The programs within the intervention are student chapters, conferences and events, and resident engagements. Lamya will now go into each of these components in a little bit more detail.
Thanks, Joëlle. So our KNN student chapters began in the fall of 2022 with 8 chapter sites at the KNN's founding member medical schools. Since that time, it has grown more than threefold to participants from 36 medical schools across the country. Each chapter consists of a group of student leaders who take on learning about the Canon framework for flourishing and apply it to their medical school. They also identify a chapter champion who philosophically supports their work and provides institutional navigation at their individual school. Student chapter leaders recruit students to participate in their chapter and hold framework-related programming throughout the academic year. Chapter leaders also participate in the national conversation by documenting the work that they do locally and presenting it to their chapter leads, colleagues at other schools. So a few key support documents facilitate the work of KNN student chapters. A program planning document and an annual student chapter poster template both ask student leaders for Flourishing to identify issues or problems at their home institutions, create a research question and hypothesis for how their interventions will address the issues or problems, think about how they will know if it's working, and then design and refine from there. Student chapters receive funding to carry out their initiatives, as well as implementation support from the KNN Program Office, which are important steps in moving from theory to practice. The KNN Learner Network also engages participants in regular conferences and events, such as the monthly Becoming series, where students present their thoughts on topics related to the KNN framework. The topic for this month's session, for example, is Wholeness of Being and Doing, Interests, Hobbies, and Practices. This past weekend, we also held the third annual KNN Student Conference at Creighton University's School of Medicine in Phoenix. This annual event is planned and facilitated by students. It's an opportunity for existing student chapter leaders to report out on their work and also is a time for onboarding of new chapters. In the fall, we have the National KNN Conference in which learners are supported to attend or present their research. As of last spring, we made an intentional shift from student network to learner network to account for a wider range of learners and maintain the connection with those highly engaged medical student leaders as they enter into the next phase of residency, internship, and fellowships. We brought residents together through a partnership with the Good Listening Project, through which individual residents were paired with listener poets and were given the space to share their story. The residents from this first cohort connected in person at the last national conference, and in the current moment, we're actively recruiting for the next resident cohort with the Good Listening Project. Additional future programming for residents will focus on the program level through workshops, professional development, lectures on the framework and related topics, as well as policy, advocacy, and research support for residents with the desire to study flourishing amongst their population group. With that, we'd like to share some insight from current KNN student chapter leaders as it provides perspective into their engagement and application of the framework on the local and national scale, and the impact of having the shared language and aspirational aim of flourishing on their physician journey.
I really do enjoy the framework. I like that it is something that can be sort of scaled up and scaled down to the needs of the reviewer, the evaluator, the student, the learner, kind of whoever's really looking at it. It gives you this nice way to talk about really sort of theoretical, up in the clouds, difficult kind of ethos conversations, and at the same time really boil it down to something that is very tangible and direct and actionable. And I think the framework can really serve as a very nice bridge between our preclinical didactic years into our actual clinical years, because it's very easy to talk about a lot of these concepts and what it means to be a good doctor, or to lead with your values, or to talk about all these things, and then it's a little bit different sometimes to actually practice it. But I think the framework is a nice way to sort of transition between the two. And as far as how the framework has helped me develop, I do feel like the framework gave me a way to be much more intentional kind of with the decisions that I was making about life, and a way to also break down a lot of my experiences, to think about them, and when I'm reflecting back, both to consider did I accomplish my goal? Was I caring in that moment? Did I use character? As well as in those moments having the practical wisdom sort of built to actually decide what does need to happen in this way. And so it's given me this way to sort of walk through life, I feel with my eyes much more wide open, much more considering, observational, and something I certainly did not have prior to being involved.
How to apply the framework in my personal and professional life. It inspired me to keep sharing this with the communities I was a part of. I became a KNN student leader at Geisel, And I helped host events at the school, including a student-led retreat, character development sessions, and clinical reflections. I've also had the pleasure in helping share the KNN mission within the national organization, leading presentations at both the student and national conference, presenting at becoming sessions, and collaborating with other students in the KNN community on research projects to share these passions with the broader medical education community. To me, the framework for flourishing is so important because it gives us a shared language to discuss about the deeply important and human traits that makes us great doctors. So much time is spent on medical content, and in my opinion, not enough energy is spent on exploring caring, character, and practical wisdom in this quest for flourishing. I find that emphasizing these values makes me feel so much more connected to medicine and the reasons why I want to become a doctor in the first place. With the stress, long hours, and truly difficult emotional situations we encounter on a day-to-day basis, focusing on the framework elements makes us more resilient for ourselves, our teams, and our patients, and ultimately, I believe, makes us better people.
I was introduced to the KNN through a project that I was working on with our Dean of Student Affairs titled the Leadership and Professionalism Summit. We kind of stumbled on them and got to know the KNN just because of common values and kind of a common mission. And what we didn't realize at the time is that the key word that we were missing was flourishing. So we were working on this Leadership and Professionalism Summit that we were hoping to really emphasize and build critical skills in medical students tied into leadership and professional identity formation. When I learned more about the KNN, I realized that they talked about and emphasized all of these same things, but they talked about it in the context of flourishing. And when I realized this, and when I learned more about the KNN framework, it really revolutionized my view on critical skills that we emphasize and talk about in medicine. So the more I learned about them, the more I fell in love with them. So I went on and started a student chapter here at our Creighton Medical School Phoenix campus. And I realized that the framework, at least for me in my medical journey, provided really critical perspective on why do we talk about these concepts, or why do we even say that they're important? You know, the concepts of professionalism, leadership, integrity, character, et cetera, and the way that KNN really, spun it is it's critical to your overall flourishing. Not only will you be able to serve your patients, your community, your colleagues better, but you as an individual will serve, yourself. You'll be more rooted in your mission and your values. And it was really that rootedness, right? That concept of flourishing that I realized we were missing all along.
We've been able to do some evaluations of many of the components of our program and are going to launch into some formal research of our undertakings this year. We really wanted to provide our student voice with the answers to sort of, how and what is working. So we're going to finish with just a note about the strengths and limitations of the current programming. So one strength is that its growth, the growth of the KNN Learner Network seems to indicate that there is, in the very least, interest in the program, if not a need for it, to address the issues reflecting medicine and medical education that have been sort of studied, researched, and noted elsewhere. In agreement with Lamya and Brooks in their 2021 article, How Can Universities Cultivate Leaders of Character? The programming includes learning about character, so virtue literacy, along with action and reflection, components of which may lead to long-term learning and actual behavior change. Finally, the programming is longitudinal with many ways for people to engage, so it has the potential to scale and work at a systems level. In terms of scale, a limitation of the programming is the organization's capacity to scale, as well as to maintain program quality as it grows. Our learners have actually noted this themselves, that they feel a deep sense of quality around the program, and that they are worried about what would change as it grows. Additionally, we recognize that many factors impact an individual's ability to feel as though they are flourishing. So the program itself may not provide statistically significant results as it relates to participant flourishing, even if it is able to produce some good positive results. Finally, the current evaluation methods are largely reliant on self-report, so additional ways to measure and demonstrate program effectiveness that include some more objective measures may strengthen any future study design and findings. Now we'll move into the question and answer portion of our event.